Hello, everyone. Welcome. I am Robin Keogh, the Executive Director of the Federal Employee Education and Assistance Fund, more commonly known as FEA, and it's my pleasure to welcome you to the final Wellness Wednesday of the 2024 Feds in Motion Challenge. The challenge is an annual event that supports FEA's mission to empower federal and postal employees and their families to achieve their educational, financial, and career goals as they serve the American people. Thank you for joining us throughout the last 5 weeks and for your support of federal families. We hope you've enjoyed these sessions as we have focused more deeply on different aspects of wellness with experts who work, teach, and coach in the fields we've explored. Today's Mental Gymnastics Keeping Your Brain Healthy as You Age session is brought to you by Platinum sponsor Blue Cross Blue Shield Federal Employee Program. Blue Cross FEP has supported FEA and Feds for our entire 38-year history. Whether it's sponsoring the challenge or helping us provide more than 100 of our scholarships each year, or jumping in when disasters or shutdowns impact federal families, Blue Cross FEP is a great friend to FEA and to Feds. And we'd like to recognize the more than 75 BCBS team members who've joined us for the challenge. We hope you've had a great time and will join us again next year. To say a few words and introduce our presenter, it's now my pleasure to introduce Vanessa Hatch, Vice President of FEP Clinical Operations and Pharmacy Programs, Government Programs at Blue Cross Blue Shield. Vanessa?
I'm so glad to be here because Blue Cross Blue Shield FEP has been a longtime federal employee education and assistance fund advocate for over 35 years. We're proud that over the past 8 years, BCBS supported FEA's mission with more than $2 million in contributions for scholarships to federal employees and their families, as well as emergency loans to those experiencing tough times. Participating again this year as the Feds in Motion Platinum sponsor is an honor because FEP believes that our support of federal employees, retirees, and their families goes beyond providing their health benefits. Our commitment to the entire federal community is to make sure we also provide opportunities for improving wellness and advancing health equity. This event brings with it the opportunity for all federal employees to up their game, consistently exercising their right to get healthier. As the #1 health insurance carrier for federal employees, FEP is proud to support the health of those individuals selflessly serving our nation every day. Whether you're processing and delivering our mail, keeping us safe along our borders, or helping our veterans navigate their health challenges. All you have to do is walk, run, bike, swim, or roll your wheelchair 37 miles in 37 days. Last year, the event raised over $100,000 for those in need. Let's see if we can raise even more this year. To everyone participating in the Feds in Motion Challenge, BCBS says good luck. I encourage all of you to get out there and to get those miles. And remember, BCBS will be with you every step of the way. Dr. Vonetta Dotson is a neuropsychologist, author, and speaker. She completed her doctoral training in clinical psychology at the University of Florida in 2006 with a specialization in neuropsychology and a certificate in gerontology. She is a licensed psychologist in the state of Georgia, and her career has focused on teaching, providing clinical care, and conducting research related to brain health and aging. Dr. Dotson is also a professor at Georgia State University, a senior project scientist for behavioral health at NASA for KBR, and author of the book, Keep Your Wits About You, The Science of Brain Maintenance as You Age. Additionally, she is the founder and president of her startup, CerebroFit, which provides services to empower people in the community to live a brain-healthy lifestyle.
Thank you so much for that introduction and for having me as part of this webinar series. I'm excited to talk to you about my passion, which is helping people to have a healthy lifestyle that promotes a healthy brain throughout their lives. So why do I care so much about people having a healthy brain? Well, it's because having a healthy brain affects all aspects of our lives. From the cognitive standpoint, when our brain is healthy, we have better memory and cognitive skills overall, both when we're younger and as we get older. Our risk for Alzheimer's disease and other types of dementia goes down. And then there are also mood benefits. When we have a healthy brain, our mood is better, our overall feeling of well-being is better. And having a healthy brain even lowers the risks for conditions like depression and anxiety disorders, because these are all based on the functioning of the brain. We also have physical benefits where when our brain is healthy, our physical performance is better. And that translates into better functional independence as we get older. This is really important because so many people have concerns about losing their independence in terms of driving, especially, but also things like managing their finances and their health care as they get older. And when their brain is healthy, they're able to hold on to that functional independence longer. So how do we achieve and maintain a healthy brain? There are certain pillars of brain health that research has shown over and over again are beneficial for brain health throughout our lifespan. And this will be the focus of the presentation today. We're going to talk about physical activity, cognitive stimulation or cognitive engagement, being socially engaged, getting good sleep and having a heart healthy diet, and then having good physical and mental health. So the first thing we'll jump into is physical activity. This is something that's near and dear to me because the research that I do at Georgia State University, where I'm a professor, as you heard, is a lot focused on how exercise affects our brain throughout our lifespan and how that translates into better cognitive functioning and mood. So the reason that drives my interest in this area of research is because of the many, many benefits that we see that exercise has on our brain. So I've said exercise, but I've also mentioned physical activity. So let me stop for a minute and be clear that those are kind of two related but different activities. Physical activity is any kind of movement that uses your muscles and that expend energy. Exercise is a subset of physical activity that's structured and intended to improve physical fitness. Well, the good thing is that the research shows that both physical activity in general, as well as exercise in particular, are really great for the brain. So what I have here on this slide is just about the physically active brain, physical activity in general, as well as exercise specifically. What we see is that people who are physically active and who are more physically fit have better brain structure and function. Exercise can actually increase neurogenesis. That is the generation of new neurons or brain cells, which is really, really exciting because for many years we thought that, when I say we as a society or as researchers thought that as people got older, they lost their ability to generate new neurons. Well, that's not true. Even into late life, you can have neurogenesis, and exercise is one way of boosting that process. That then leads to larger volumes or larger size of different parts of the brain. And also importantly, exercise can help to reduce the pathology that causes Alzheimer's disease. So there's plaques and tangles that we know are part of the cause of Alzheimer's disease, and exercise actually helps to clear those plaques and tangles out. When it comes to the functioning of the brain, what we see is that people who are physically active have better functioning of the brain during different tasks, whether they be mental tasks or physical tasks. And related to that, the connections between parts of the brain are improved. So the brain has to communicate with itself. Different brain regions have to be connected from both a structure standpoint, like physical connections, but also how they work together. And all of that is improved by exercise or physical activity. Another important point is that exercise or physical activity can improve the vascular health of the brain. So the same way that exercise is good for your heart, which is also vascular, we call that cardiovascular, it's also really good for your brain blood flow, which we call cerebrovascular. So you have improved blood flow, the health of your arteries and capillaries in your brain are better, and that's going to translate to better cognitive functioning as well. And then finally, I'll just mention that the exercise and physical activity have lots of effect on brain chemistry. So there are some chemicals that we know are positive and helpful for cognitive functioning and for mood, such as endorphins and epinephrine, and all of those are increased by exercise. There's also something called BDNF, which stands for brain-derived neurotrophic factor. This is a chemical that's really important for the health and survival of neurons. And BDNF is increased by exercise, which is probably one reason why exercise can increase that production of new brain cells. On the flip side, there's chemicals that, if they're elevated for long periods of time, are bad for the brain, such as cortisol, which is a stress hormone, and inflammation. And exercise helps to decrease that increase in cortisol and inflammation. The inflammation part is really important for a number of reasons. One of them being that we know that as we get older, there can be more chronic inflammation in the body as part of the aging process. And so exercise can actually help to reduce part of that normal aging process that can lead to cognitive problems. So I mentioned that physical activity in general is beneficial, and that's because movement of any type is really medicine. It's medicine for our physical health overall, for our brain health, for our mental health. And so we know that there are different types of movement that all are helpful. So everyday activity, doing chores, walking, doing yard work, anything that uses energy is going to be good for brain health. But when it comes to structured exercise, we also know that there are overlapping but still distinct benefits that come from different types of exercise. For example, aerobic exercise that gets your heart rate going is what tends to be studied the most in the research literature, and we see the most consistent brain benefits of that, particularly when it comes to the vascular health of the brain and also increasing that neurogenesis. Resistance training, so anything that builds muscle, that can be with body weight, it can be with resistance bands, it can be with dumbbells, anything that uses your muscles and builds the muscles is also really important. And research shows it is really particularly good at increasing BDNF, which is that chemical that I mentioned is really helpful for the health and survival of neurons. And that then translates to benefits to cognitive functioning. Also really helpful for your brain is mind and body exercise. So this is going to be things like yoga and Pilates and Tai Chi that not only have that immediate amazing mental health benefit. I'm sort of biased because I teach fitness classes in my spare time. I say that kind of jokingly because I'm busy, but I make the time for it. And it's just absolutely, my therapy, my medicine, because it has that immediate benefit for mood. But also research shows that there's these long-term benefits for mood, for attention, executive functioning, and other aspects of brain health. So basically, move is the take home from this. Any type of movement is good. And I've already mentioned some of this, but I'll just kind of say briefly that you do have both cognitive and mood benefits that come from exercise, because when the brain is healthier, again, we see these benefits for both cognitive functioning and for mood. So abilities like attention and memory are enhanced in people who exercise regularly. There's also a subset of cognitive skills called executive functioning. These are complex cognitive skills like organizing, multitasking, problem solving. All of those are improved in people who exercise. And what we see in terms of cognitive benefits is that you can have both short-term and long-term benefits. So after one acute bout of exercise, you can have improvements in abilities like attention and memory for about 2 hours, that you actually focus better, you remember better right after having exercise. But of course, that doesn't last forever. You need to have that as a regular habit before you get the long-term benefits, such as that overall improvement in cognitive functioning and that risk for dementia that gets lowered in people who are more active throughout their lives. And then when it comes to mood, we can have, again, short-term and long-term benefits. On the short term, right after exercising for up to 24 hours, people report more positive mood and less negative emotions, such as tension and stress. And then long term, what we see is that people who exercise more or who are more physically active do have a lower risk for depression, but also really important, exercise is incredibly effective in treating depression. Some studies actually show that the benefits of exercise for depression can be just as strong as the benefits as antidepressant medication. So when you think about exercising, it's important to kind of keep a few things in mind. So a few tips, and I'm going to give you tips for each of the activities I'm going to talk about. One is to have fun. In order for you to make a habit, it's easier to do when you're enjoying what you do. So find activities that you enjoy, keeping in mind that anything that requires movement is good for you. Having variety can be helpful for preventing boredom. And sometimes you just want to exercise or be active with other people. That can also increase your motivation. You want to start small because you don't want to go from being completely sedentary or not moving much at all to all of a sudden trying to train for a marathon. That's a little bit too ambitious. Take small steps. You can say you're going to add 10 or 15 minutes of movement each day. You can do something as simple as walking and build up from there. But know that those little small bouts of exercise start to add up to really big health benefits. That's related to safety because if you don't start gradually, you can, of course, have physical injuries that can occur. So if you have not been active until now, then talk to your doctor, make sure you're cleared for exercise, and just, start slowly. And then make a plan. We tend to stick with a plan when we've thought ahead of time. You can put it into your calendar, which is what I do. I make an appointment to exercise, and I treat it like every other appointment in my calendar. You can write out weekly goals, just different things that get you really organized and planned about it can be really helpful. Okay, so we're going to move on to the next healthy behavior. I'm going to go through the rest of them a little bit more quickly than exercise. I focus a lot on exercise, not just because I'm biased, because it's what I do for my research, but also because research does show that the sort of most consistent benefits that you get for brain health out of everything we're going to talk about does come from exercise. Doesn't mean you shouldn't do the rest of them. It's just saying if you're going to pick a place to start with moving and then try to add on more of these behaviors that we're going to talk about. So the next thing is stimulating your brain, engaging your mind. So cognitive engagement or cognitive stimulation has to do with the idea of use it or lose it. So when it comes to your brain, you do want to keep your brain active by doing new, different, and challenging activities in order to have it continue to function well. And this applies throughout our lives. You'll hear me say multiple times that brain health is a lifelong process, and it is. What we do early matters, but it's never too late to start. And what we do later on matters as well. So things like having a high quality education early in life sets your brain up for better brain health as you go throughout your life. But that doesn't mean that you stop there. And it doesn't mean that you can't start to build some sort of brain health later on in life. It just means that it gives you a good start. In adulthood, things like having a job that's cognitively demanding, that requires problem solving and learning new things, is also associated with better brain health. But if you have or have had a job that's not super cognitively demanding, don't worry. You can still get benefits from having things such as mentally engaging hobbies that you engage in. So having things that, again, either in your job, in your spare time that you do, that keeps you learning and doing new things is all really great for you. And this relates to this whole idea that you can still benefit no matter what time you start. It's never too late to start. So older adults who maybe didn't have a high quality education, who maybe didn't have a job that required a lot from a cognitive standpoint, they can still see benefits to their brain if they start to engage in different activities that really kind of challenge them. You can also see that even in people who have dementia, that having some kind of mental stimulation can be helpful in not only doing things like reducing agitation and improving mood, but also for some people can help them buy some times in terms of their memory, that their memory can be a little bit more stable and sometimes even improve a little bit if they start to have a lot of mental stimulation. Unfortunately, that does not mean that we can reverse the dementia because right now we don't have a way of doing that. But for the person who has dementia in their family, even getting some extra time of stability can be really, really impactful. So all of this relates to this idea of what's called cognitive reserve. So cognitive reserve is a term that neuroscientists and psychologists use to refer to this buffer against brain damage. What that means is that if you have a life that is full of all sorts of engagement, so the cognitive engagement we talked about, social engagement that we'll get into, kind of complex occupations, et cetera, what that does, what research shows, is that people who have a life full of these sort of positive activities have this buffer where if they have some sort of brain damage, let's say they have a head injury or they have a stroke, the degree of cognitive and memory problems they have afterwards are not as great oftentimes as what you see in people who have less of those activities in their history. So it means that you can kind of, your brain has learned to sort of compensate in various ways for having damage to it. And that can be helpful, again, for protecting yourself and having some greater stability, even if something like Alzheimer's disease or other types of dementia start to develop. Will you still ultimately develop the same symptoms as everyone else? As of right now, yes, because we don't have a cure, but you can have your onset of your symptoms be later in life and you can buy more stability. So that's the idea of cognitive reserve, and cognitive engagement is a big part of that. So some tips in terms of staying cognitively stimulated. You want to think about participating in a variety of activities, so not just the same thing over and over again, that are new, that challenge your mind, that keep you engaged, and hopefully that you find fun. So the key is having those characteristics, not necessarily that one activity is the thing to do. You want to mix it up. It's always great if you can combine cognitive engagement with a physical component. Actually, studies have shown that if you are exercising, but also having to use your brain, if you will, in different ways. So for example, taking a dance class where you're having to learn moves and kind of keep up, that you actually get more benefits to your brain by mixing in the cognitive part and the physical part. And I think important as we get older is to let go of aging stereotypes. So there's a lot of ageism when it comes to learning new things. You know, the old saying, you can't teach an old dog new tricks, is one of my least favorite things that I hear people say, because it really enforces this stereotype that's really not true, that as you get older, that you're not able to be flexible to learn new things and to challenge yourself. You actually can do all those things at any point in life. And so try not to internalize those stereotypes. Try to take on new challenges regardless of your age and keep your mind active. Okay, so let's talk about another type of engagement, which is social engagement or social activity. So we've learned a lot during the pandemic and reinforced things that we knew before about the effects of social isolation. And so I want to talk a little bit about what research shows. So social isolation is this lack of contact with people, lack of social contact. And being socially isolated can lead people to feel lonely. So that's going to be a subjective feeling of being isolated or alone. And then when that happens, what we see is that there are lots of negative repercussions. There can be some decline in cognitive functioning and in memory. There can be changes to the brain in terms of structure and function that are all sort of negative in terms of cognitive functioning and mood. And then people who are chronically lonely actually are at risk for having a greater buildup of the pathology in the brain that causes Alzheimer's disease. So there's lots of negative effects of loneliness. And I specifically mentioned loneliness and not social isolation because not everyone who is socially isolated feels equally as lonely. Some people don't mind being more of a loner, if you will, having a smaller circle of friends. And so if having less social contact doesn't lead to loneliness, then we don't see as many of these negative effects. It seems to be that subjective feeling of being lonely that really causes the problems that we see for brain health. And so the opposite is true, that when you're socially engaged, you're having and maintaining meaningful relationships. And social engagement leads to a feeling of social connection. So that's the subjective feeling of being close to people and being connected to people. And that leads to better memory and cognitive functioning. You have fewer changes in your brain as you age, and overall, your mood and well-being is better. Again, this is one of those topics that most people just kind of say, yeah, of course, that makes sense. You know, maybe you didn't know about exercise in the brain, but you know that these things you feel better, and that your life is better when you're socially connected. But I think understanding that social connection and not feeling lonely is also important for things like reducing your risk for Alzheimer's disease is really important. And so I sort of mentioned this earlier, that it's not that there's some magic number of how much social contact you need to have or how big your social network should be. The most important factor is the match between the social activity that you want and the social activity that you have. And so when those two are connected, or when they're consistent, you have better brain health. When there's a disconnect there, then you're at risk for some of the negative brain health outcomes. So when it comes to social engagement, you want to be true to yourself, meaning that if you're someone who, again, is happy with just having a small social network and you're feeling satisfied with that, then that's fine. But if you are feeling lonely, if you are feeling disconnected, then you want to find ways to increase your social engagement. And you can do that by trying to be flexible and doing things such as embracing technology. There's lots of ways that maybe aren't quite as good as in-person contact, but you can still get benefits from having a Zoom call with your, kids or grandkids or your friends, or, there's a pros and cons of things like social media, but if it's something that feels positive and it's connecting you to people, then that's something that you can use to your advantage. And also pet companionship. Research has shown that actually owning a pet is really great for your brain health. Good news for me, because I have 3 dogs. I got a little bit carried away with the pet part of it, but it's a great thing. So pets can be wonderful in terms of benefiting brain health, and it cannot fully make up for having contact with people, but it certainly can help based on the research. Also think about variety in how you get your social contact. So you can, attend events with your family, cultural events, religious activities, and things like volunteering are wonderful for brain health. When you're volunteering, not only are you having that social contact, most likely, depending on how you're volunteering, but you're also getting oftentimes cognitive benefits from learning something new or doing something different. You get that sense of satisfaction that also is positive and boosts positive chemicals in your brain from having this altruistic behavior that you're doing. It's just a wonderful way of improving brain health. And then, similar to what I said about the cognitive activity, try to combine brain healthy activity. So if you have something that's a social activity, but that also includes physical or mental challenges, then that's going to be that much better. Okay, so now let's talk about nutrition. So I think the social engagement is the part that people are most open to hearing because it sounds fun. Nutrition is where people, sometimes I lose them. So stay with me. I'm not going to tell you that you need to take anything out of your diet completely. I will tell you what things you should emphasize based on research to have the best brain health. So what research shows is that heart-healthy diets are your best bet for having a healthy brain. And so that means that you want to emphasize certain types of foods and nutrients and have less of the things that are not quite as good for you. And you've probably heard of the Mediterranean diet or Mediterranean style diet. And that's the type of eating habits that are most associated with good brain health. And so what does that mean? It's a dietary pattern that includes lots of fruits and vegetables, whole grains, potatoes, and beans. The fats that are used in this kind of dietary pattern are more healthy fats. So things like olive oil, more olive oil, less butter, for example. Having more of a moderate amount of poultry and eggs is part of it. And then limiting things like red meat, refined grains, and sweets. And notice that I said limited. That doesn't mean that you have to necessarily take them all out, but it does mean trying to have less of that and more of the other things. And then within the Mediterranean style diet is actually a moderate amount of wine, which some people get very excited when they hear that. There's obviously other negative health outcomes that can come with any amount of alcohol. But in terms of brain health, actually moderate amounts of wine has been shown in different studies to actually be helpful in some ways, potentially, at least in part, because some of the chemicals that are in red wine in particular within the grapes that seem to be helpful. So that's the overall dietary pattern that has the strongest link with good brain health. And I've said the word pattern over and over again, because again, I think it's important that for developing long-term habits, going on a really restrictive or extreme diet does not tend to be the way to go. People have a hard time sticking with it. It leads to a lot of like yo-yo dieting that is really bad for the body. And so it's better to just think about how can I maximize the things that are good for me and minimize the things that are not quite as good. You also want to avoid focusing just on one nutrient or micronutrient. So that, for example, there was a time, a few years ago where people decided that blueberries were the superfood, and people were eating blueberries all the time, like multiple times a day, every day. No, that's not the way to go. By doing that, number one, you're going to get sick of blueberries, and then number two, that means you're having that all the time to the detriment of other nutrients and foods that you do need. And so you want to have more of a balanced diet and not focus so much on one micronutrient. I get a lot of questions from the patients that I see and when I give talks about brain health supplements. And it's an interesting area of research where, people who develop what they call brain health supplements that are going to boost your memory, et cetera, oftentimes they'll develop some type of blend of ingredients that they claim has these great benefits for memory and for brain health. But when independent researchers try to validate their findings, they don't see any benefits. So the consensus in the research world is that brain health supplements do not have any established consistent benefits for brain health. And on top of that, because supplements are not regulated by the FDA, what you can see is that there's oftentimes ingredients in them that are not listed. And so those things can be harmful. They can mix with your other drugs, and it's just one of those things you got to be careful about. As a psychologist who focuses on healthy behaviors, I also worry that when people rely on supplements, then they are not as motivated to actually do the behaviors that are helpful for them. So in general, brain health supplements are not the ideal way to go. I will say that if someone has a deficiency in any kind of nutrient that their doctor tells them, then yes, take the supplement. I'm not saying supplements aren't good. I'm saying that when it comes to brain health in particular, you're going to get more benefit from healthy behavior than you are from supplements. So when you think about nutrition, you want to again focus on a heart healthy diet and not overall healthy patterns, not specific nutrients. In general, try to get your nutrients from a balanced diet. So most nutrients we need, we will get them if our diet is balanced. Again, if your doctor says that you have a nutritional deficiency that requires supplementation, then follow your doctor's recommendation. Try not to overhaul your diet or try to have a diet that's so overly restricted that you won't stick with it. And think about how you can sort of plan and make sure that you're thinking about your diet and your meals ahead of time. Okay. So let's move on to talking about sleep. Sleep is incredibly important for brain health and really for all aspects of health. Sleep supports all of our major body systems. It's important for the healthy functioning of our body overall. It's important for our immune system and so maintaining the balance between our immune system and other parts of the body. It's really important for our cognitive functioning, both short-term and long-term. So we know if we get a bad night's sleep, it's harder to pay attention. It's harder to remember things that you hear because you're just not having that focus from lack of sleep. But then there's also long-term effects on cognitive functioning when you chronically have insufficient sleep. And then sleep is also important for mood. It helps us to regulate our mood. Again, we've probably noticed that when we have a bad night's sleep, you're more cranky, you're more irritable. So mood regulation is not as good if you don't have enough sleep. Motivation and just emotional processes in general are all supported by sleep. When you don't have enough good sleep, then your brain does suffer. And so some of the things that we see in people who chronically get poor sleep is that the volume of the hippocampus can be reduced. The hippocampus is a part of the brain that's really important for memory. It's also the part of the brain that we see is first affected in Alzheimer's disease. The pathology that causes Alzheimer's disease tends to clump up in the hippocampal areas first. And so if you already have a hippocampus that's reduced in volume from poor sleep, if Alzheimer's pathology starts to set in, you might start to see symptoms earlier because you have less healthy tissue to work with. We also see that poor sleep leads to thinning of your cerebral cortex. So the cerebral cortex is the outer layer of the brain, the kind of wrinkled, overlapping kind of parts of the brain that you see in kind of pictures of the brain. And so you want that to be nice and plump. But what you see with poor sleep is that it starts to get thinner. So that cortex starts to get thinner. And then related to the first 2 points is that the ventricles in the brain get larger. So the ventricles in the brain are those holes that naturally occur. They hold cerebrospinal fluid, which helps to cushion the brain. And when the ventricles get larger, that's not a good thing. That's actually a sign that you're getting less volume in the brain because the ventricles are kind of getting larger and pressing up against it. So that's not a good thing. This is one part of the brain that you don't want to get bigger. The ability of the brain to regenerate and to have new neurons that we talked about, that exercise can increase neurogenesis. Poor sleep can reduce neurogenesis. And then finally, the connectivity of the brain, so how parts of the brain speak to each other, can be affected in a negative way in people who don't get good sleep. So I keep saying insufficient sleep. What does that mean? So the research shows that there's a sweet spot for brain health when it comes to sleep, and that sweet spot is 7 to 8 hours per night on average. That does not mean that if you have a couple of nights that you don't get that amount of sleep, that there's going to be huge problems right away, but you want that to be the goal overall. What's interesting is that there's research that having too little or too much sleep is bad for you. So people who get 10, 11 hours of sleep per night, don't know how they do it, but some people do, that actually is associated with negative brain health outcomes as well. Now, it could be that whatever reason drives someone to need that much sleep is what ultimately causes the problems. We're not sure why that is, but too little or too much sleep can be a bad thing from what we know from the research literature. I get a lot of questions about whether or not naps can help make up for lack of sleep. And right now, the research is not fully clear because the findings from different research studies have been mixed. Some find that having a nap, particularly within 24 hours, can help to, at least to some degree, make up for the lack of sleep. But other studies don't necessarily find the exact same thing. So the jury's out on that. I think in general, just trying to aim for getting good quality sleep at night is going to be your best bet. But that doesn't mean that a nap is a bad idea. It just means that right now, we don't know for sure if it's helpful. So when it comes to sleep, you want to aim, again, for those 7 to 8 hours of sleep if possible. And part of the way of getting to that goal is to have what's called good sleep hygiene. So that means having, for example, a regular sleep schedule so that you're going to bed and waking up around the same time every night and every morning. You want to disconnect from the electronic devices. Some people say up to an hour before you go to bed for multiple reasons. Number one, the blue light from electronic devices does affect melatonin, which is important for inducing sleepiness, and just overall kind of gets your brain primed to be up as opposed to getting sleepy. But also because oftentimes whatever you're doing on your electronic device is engaging and kind of keeping you activated. And so that can be counterproductive for getting sleepy. Some people find it really helpful to practice relaxation strategies before bed. So mindfulness, meditation, deep breathing, other relaxation strategies can be really helpful. And sometimes, despite doing all these good sleep hygiene sort of techniques, some people just have persistent sleep problems. And if that happens, then you want to see a psychologist or another healthcare provider who can help with that if you're having signs of a sleep disorder, which goes beyond just having a few bad nights of sleep, but it's a more persistent chronic condition. Okay, so now let's talk about the last sort of two lumped together healthy behaviors, which is thinking about physical and mental health. And I bring these two up together because they're really interconnected. And I think it's important when we think about mental health is to understand that it is part of overall health. It's not some separate thing that we don't talk about that needs to be seen as different than other aspects of health. When it comes to brain health, what I think about right away, because there's so much research linking the two, is heart health. Heart health equals brain health. Heart health and brain health are so inextricably intertwined. And I mentioned this a little bit earlier, and just to get a little bit more into that link between the two, what we know is that vascular diseases, so diseases that affect the blood supply and blood flow, can affect brain health. And this is true for heart health or cardiovascular health, as well as for cerebrovascular health, so the vascular health in the brain. But there are also risk factors for vascular disease, things that increase your chances of having heart disease, coronary artery disease, etc. And these are things like smoking, obesity, high blood pressure. Those in and of themselves are also associated with negative brain health measures. And by that, I mean things like cognitive functioning, things like mood, things like the volume of the brain, etc. And what's important when it comes to heart health is to understand that, again, brain health is a lifelong process. What you do earlier on really does matter. So research shows that if you look at heart health, even in young adulthood, people in their 20s, that gives you a clue about what their heart health is going to be 20 years later, 30 years later into midlife. But research also shows that if you look at people in middle age, their heart health predicts their brain health later on in life into old age. So basically, it all ends up being connected. What you do when you're younger matters. And so you really want to think about heart health, not just when you get older, which is kind of I think most people kind of wait until they're older to say, oh yeah, how's my blood pressure, how's my cholesterol? That's something we should be thinking about throughout our lives, because earlier heart health affects later life brain health. So I mentioned heart health because that's one of the biggest category of physical health conditions that are related to brain health. But in general, you want to make sure that you're getting treatment for physical medical conditions. And then when it comes to mental health, there's so much we could talk about, but I wanted to focus on stress, because stress underlies so many mental health disorders, particularly depression and anxiety, which are the two most common mental health disorders. And that's really important because stress has a tremendous impact on the brain. When we are chronically stressed, again, we all experience stress, that's part of life. And I'll just briefly mention that stress is not always bad, right? There can be good stress. It's considered stress if someone is excited about the ending of a ball game. That's stress. Whether you're feeling positive, that's still stress. That's fine. Those short-term kind of stressful things are absolutely fine for your brain. But when it comes to elevated chronic stress, and the kind that causes the worry and the negative emotions, what we see is that cortisol, which is again that stress hormone in the brain, stays elevated for long periods of time. And that's a bad thing because it actually starts to wear away at different parts of the brain, including the hippocampus, which is again important for memory and kind of the main focus initially for Alzheimer's disease. So it can lead to degradation of the brain when you have cortisol that's elevated for long periods of time. And then you can also have this state of chronic hyperarousal. So what's healthy for our body is for our heart to get elevated in response to physical or mental exertion and then to come back down. But when you're chronically stressed, you stay at a kind of higher level of arousal all the time and you don't come back down. And so that can cause what's called a lower heart rate variability. In a healthy situation, our heart rate gets lower in certain situations, then higher in other situations. People who are chronically stressed have a restricted range of their heart rate. It stays in the higher level longer. And as you can imagine, that wears away at the heart. The heart is not meant to be that active all the time. So it can cause a lot of vascular problems, cognitive problems, and brain health problems overall. We also see that with chronic stress, we can have changes in the brain, including these different kind of networks or circuits of brain regions that work together. One of them we call the salient circuit, that includes parts of the brain that we know are important for cognitive functioning and mood. The amygdala, which is really important for kind of our fear response and anxiety. The prefrontal cortex, it's really important for cognitive functioning and for mood. And then the hippocampus, which is, as we mentioned multiple times, is important for memory. So there's lots of physiological effects of stress. So managing your stress is incredibly important for brain health. And that's because there's really an interrelationship between stress and other aspects of health. So when we're chronically stressed, our brain can be affected, which affects our cognitive functioning, affects our ability to kind of go about our day-to-day life. But chronic stress also leads to mood changes, sleep problems, et cetera, that also on their own affect the brain and affect cognitive functioning. So you really want to find a way to kind of stop this sort of vicious cycle that can happen by trying to manage your stress. So one thing that comes from that diagram I just showed you is that since everything is so interconnected, when you think about healthy behaviors that promote a healthy brain, you also are promoting physical and mental health. It is really hard to disentangle brain health, physical health, and mental health. They all overlap. They're all connected to each other. And so all the things that we've talked about today really are going to converge on better health overall. So I focus on brain health, but that's going to affect mental health. It's going to affect physical health as well. So when it comes to physical and mental health, you want to make sure you're proactive. If you have any kind of concerns about physical difficulties or mental health, a lot of us face barriers to having a healthy life, whether it be financial barriers, whether it be just kind of practical barriers, depending on where you live, reaching a doctor, finding a therapist, whatever it is. So talk to your healthcare providers about those barriers so they can help you overcome them. When it comes to therapy, what I see oftentimes is that people will say, oh yeah, I tried therapy, I really don't like my therapist. And I say, well, there's thousands of us. And even now it's even easier to find a therapist. I don't want to say easier. Therapists can be more accessible because we do teletherapy now. And so you can sometimes say, I live in a rural area, I don't have someone in driving distance, but you may be able to see someone through telehealth. So don't give up if you see a therapist and it's not a good fit, you didn't get along with them, what have you. Keep looking. It's worth it to be able to take care of your mental health. And then you want to think about prevention for both your physical health and mental health, that prevention is the best medicine. If you can do the healthy behaviors that we've reviewed today, that will help to prevent both physical and mental health problems. Does not mean it's a guarantee, things do happen, but you can certainly lower your risk. And then you also have tools in your toolbox to use to help you get through those conditions, because all these healthy behaviors are good for prevention and for treatment. So I've gone over a lot, and it might sound overwhelming because it's a lot to think about, overhauling, changing your life completely in a way that's going to be good for your brain. And just to kind of pull back a little bit, what you want to think about in terms of starting a brain healthy lifestyle or maintaining one if you already have it, is at first you want to have very realistic, specific goals. It's not reasonable to try to change every behavior that I mentioned at one time and to go for like the ultimate goal right away. What you want to do is think about one or two categories of these behaviors and try to make one small step in each one. So you can say, for example, you're going to work on exercise because that's one of the ones that has such a big impact. And then make your goal really small. You can say that 3 times a week, you're going to walk for 15 minutes. That is very concrete. Put it in your calendar. Decide you're going to do it during your lunch break. Decide you're going to do it after dinner, but make it a plan. That's one goal. And then maybe pick something else. You can say you want to work on nutrition and make one change. You can say you're going to substitute your dessert every night with a healthier option. So something that's involving more fruits and nuts and less of the ice cream or cheesecake. I say cheesecake because it's my weakness. So you can do that by saying you're going to limit yourself to dessert once a week, and the other rest of the week you're doing something healthier. Again, that was a little detailed what I got into, but the point is that those are 2 concrete goals, and not saying you're going to try to do all of it at one time. Plan ahead, put it in your calendar, make a meal plan, all the things that will help you be more likely to succeed. Know that barriers will happen. So it's not if barriers occur, to when they occur. Try to think about ahead of time what could get in the way. It could be weather if you're planning on exercising outside. It could be time constraints, which is very common. So try to think about barriers and think about how you might overcome them. Think about creative ways to still reach your goal. As I've mentioned multiple times, try to keep it fun. You're going to stick with habits if they're fun for you. And then, as we've mentioned multiple times, if you can combine brain healthy behavior, you get more bang for your buck. So exercise with a friend, you get social and physical activity. So those are just some tips to get you started. That does not make it easy, but these are important goals to have. And as I have said over and over again, brain health is a lifelong process. It really is. So know that that means take little steps at a time, keep working on it. Work on it now and keep working on it, and your brain will thank you for it. So with that, I really appreciate you taking the time to watch this. I hope you learned something. There's information here that might be helpful for you to continue in your brain health journey. So one is I have a QR code you can scan to order the book that I wrote about this topic, which really goes into it in much more detail and gives a lot of practical tips for being able to implement into your life. I also own a company that puts all of this into action called CerebralFit. So you can follow us on social media, which actually is a good way of getting brain health tips because 5 days a week we post about brain health and about articles that have come out that are relevant to it. You have my contact information there up top. If you have questions after watching this, please do reach out. I love hearing from people who attend one of my speaking events. And with that, thank you again for your time and your attention, and enjoy your new brain healthy life.
Dr. Dotson, thank you so much for that. That was so interesting. And I have to say, it might sound obvious to people, but the one thing that all of that reinforced for me is that your brain is a part of your body. And there's a constant feedback loop between
Yes,
your brain and the rest of your body. And that,
absolutely.
it's about keeping your entire self healthy in a variety of different ways to help keep your brain at its best.
Very well put. Absolutely.
So thank you so much for that. I really appreciate your time today and sharing your expertise with us and our audience. I also want to thank Blue Cross Blue Shield for their support of the event and of today's Wellness Wednesday. And I hope that everyone who's watching today will stay in touch with FIA after the challenge ends, both for other information and events that we do that are useful to federal employees, but also to know how your support of the challenge impacts federal employees all year long. And I hope that you'll join us for the challenge again next year. So look out for early bird registration starting in December.